So I grew up in Cardle, which is a small rural community up in far north Queensland, and I've loved growing up in this community, although we've had a couple of challenges over the years. I mean, we've had a couple of cyclones as well, and I notice every time a cyclone comes through, it impacts not just my family, but also the community. There's almost like a ripple effect that goes throughout, and that's why I decided to do a course in mental health first aid.
The moment that it really hit home to me how important this whole mental health first aid training course is to everyone here at college is when a parent came down to visit their son and daughter, and I'd never met them before, and they came up to me with a tear rolling down their cheek and just gave me a big hug. I think that really hits home about why we all do this. We're doing this because we care about the people, and we care about the students here, and we care about our friends.
Family law is particularly stressful. Clients are sometimes going through the worst situation in their life, and there's a significant amount of stress that they're dealing with that you have to help them through. I'm using the mental health first aid skills to better look after myself and to help support my family law clients who are going through a really difficult time in their life. I'm also educating the next generation of lawyers on the importance of good mental health.
In the wider community, I've been able to see a lot of people who've gone through various challenges. You find people who are just newly being introduced into the Australian society. They've come from a very different background. And so being able to support people like this has always been something I've been very, very, very passionate about.
I work in human resources, and I remember one day observing my manager who was supporting an employee who was having a mental health crisis. And my manager had such confidence to support this employee and get them to seek professional help. And when the employee was safe, we had a debrief, and my manager said to me that she'd gained the skills to have that conversation through the mental health first aid training program. And that's when I decided that I too wanted to be a mental health first aider, and I booked onto the next course. I am a mental health first aider.
I am one.
I am one.
I am one.
I am one.
Be one too.